Dr. Kathy here with Becky, one of my fabulous patients. We're going to do something different today. So Dr. Kathy at your cervix, and we're in the office and we're going to answer patient questions. So Becky has graciously volunteered to ask the questions that I hear.
Yep. So I have about 9 questions.
Okay.
The first one, is it normal for my stomach to be bigger on one side?
Yes, that can be normal, as Becky is 9 months pregnant, so this is very appropriate. But babies tend to like one side better than the other sometimes, and so they'll get a favorite side. So sometimes you can see yourself very lopsided. And then after you deliver, you actually may still see your uterus tilt a little bit postpartum, in the early postpartum.
Interesting.
So yes, so no.
Kind of keeps that fine preference. Yeah. What is it with tape measuring my belly?
So what we do is that's how we figure out that you're growing appropriately. So we'll measure with the tape measure from the top of your bone to the top of your uterus, and you should equal in centimeters how far pregnant you are. And so if the baby's growing faster, getting larger, you have too much fluid, you might measure larger. Or same, if you don't have enough fluid, the baby's not growing appropriately, you'll measure smaller, and then we may order a sonogram for that.
So if I'm 39 weeks, I would be 39 centimeters.
That's exactly right. Except sometimes at the end, like you're 39 weeks, sometimes as the baby's moving down into the pelvis, we'll see that measurement get smaller.
Okay.
But for the most part, throughout the pregnancy, that's exactly right.
Okay, good to know. So the third question, can I go to the movie theater?
Absolutely. You can go to the movie theater. There's lots of noises in the movie theater, and it's the same way with concerts. Sometimes the babies will get really active due to the sound, but it's not going to hurt you or harm the baby.
Okay. Okay, next question. Can I eat raw salad?
Yes, you can eat raw salad. That question came from a couple who weren't from the United States, and their country, they have to boil all their vegetables, so they were very concerned about the lettuce here. But make sure you wash it so it's clean. But no, you don't have to boil your lettuce. You can eat raw salad.
Okay. Next one, do babies breathe while in utero?
That's a great question. Babies do breathe while they're in utero, but not like what we think. So we breathe, and we breathe oxygen down into our lungs, but babies breathe, they breathe the amniotic fluid. Now they're getting their oxygen through the umbilical cord, so not through that, but their breathing of the amniotic fluid helps their lungs mature. So yes, they breathe, but not like we think, and not like how we do.
Interesting. Okay, next question. Is it normal to have weird dreams?
Oh, yes. You can have very strange dreams, very vivid dreams, sometimes very scary dreams, and that is normal, and that is due to the hormones of pregnancy.
Okay. What is this line? And I think they're referring to that center line that goes up and down the midsection.
Yes, that dark line that's pigmented. That is called the Linea nigra, and that is a pigmented line that's due to the hormones of pregnancy, and it brings out the melanocytes. So just like how you tan in the summer, it's sort of the same thing, although it's with hormones instead of the sun.
And so the darkness can vary between person to person too, right?
Absolutely.
Like, so if I don't have a super dark line, it's not abnormal.
That's correct.
It's not normal for my body to have a super dark line.
That's right.
Okay. This is one that I actually asked even in my second pregnancy, and I knew the answer, but I had to Google it anyways, of course. Can the baby move too much?
The baby cannot move too much. Babies can move not enough, but they can't move too much. So don't panic over all that movement. That's a good sign. But if a baby changes its movement, and baby's different. So some babies will move a lot, some babies won't move much at all. But if, however their baseline is, if that falls off, call your doctor.
That's the flag.
Yes.
Yeah, I will say, for this is my second, she moves all the time, very fast, she's very rhythmic. And so you barely get any rest. So that's when I was like, I'm so tired, I'm gonna Google this. My first was a slow stretcher, and he's completely different. So I think I have my work cut out for me for when this second one comes.
Perfect. And the other thing that you mentioned that made me think about it is not all babies move all the time. So there's lots of times that you don't feel them during the day, but they have their busy times. So they'll be busy at night when you lie down to go to bed. Some babies are busy in the morning.
Yeah.
So that's the time that babies should always be busy.
Okay. Okay, and the next question is, can you sit on heated car seats?
Great question. You can sit on heated car seats. The concern about heat in pregnancy is early in the pregnancy. So before 8 weeks of pregnancy or up until around 8, sometimes they'll say 10, that is when the neural tube is closing. So what they've known from studies is that if you have a heated internal body core, that it's been shown that sometimes the neural tube won't close. So but once you get past that 8 weeks, which is very early, you're fine. And so a heated car seat is not going to heat you up so much that you have to worry about that.
Okay. And maybe as a follow-up, what is the neural tube?
Great question. Thank you for asking that. The neural tube is the part of the baby that actually closes and becomes the spine. So what you worry about for open neural tube defects is that the spine does not close, your spinal cord is exposed, and then you can get paralysis and different complications from that.
Okay.
All right.
That was the list of questions we had.
Perfect. Thanks so much, Becky.
Of course.
Now let's go to the Howl of Hope. Do something today that your future self will thank you for. If you like this video, please give it a thumbs up. If you'd like to join the Wolf Pack, please hit subscribe. And thanks so much for watching. Thanks, Becky.
Thanks, Dr. Wolf.